The first condition I'm going to talk about is a very popular one because many people suffer from this condition. It's gastroesophageal reflux disease, shortened to GERD. Basically, what happens, it occurs because the lower esophageal sphincter is weakened. And so there's a reflux of gastric contents up into the esophagus. And gastric contents are the fluid in the gastric area is corrosive. So it irritates the lower part of the esophagus. And if you have this for many years, you can get what's called Barrett's esophagus, which can turn into cancer. So it needs to be treated right away. It shouldn't be ignored. People that are obese, have sleep apnea, or wear tight clothes are going to be at risk. People on certain medications, like uh, estrogen, or if you're pregnant, you might be at risk. People with sleep apnea, I already mentioned that, are going to be at risk. Some of the causes of GERD, you can remember from the mnemonic reflux, is probably me. So R stands for a relaxed or incompetent lower esophageal sphincter. I stands for increased gastric volume, like if you ate like a huge meal, probably shouldn't do that. P is for pyloric stenosis. You're going to learn a lot more about pyloric stenosis in pediatrics, but that is a cause of GERD. And a motility disorder. For some reason, some people, peristalsis doesn't move as quickly for some people. So that could be a cause. Some food causes you can remember, it's people who eat crap. No, just kidding. So C stands for coffee, cigarettes, and citrus. R stands for refined carbohydrates. A is for alcohol and acidic and spicy food. P is for peppermint, and pregnancy actually isn't a food, but it is a cause of GERD. So the common symptoms of GERD include heartburn after eating, okay? Usually up to 2 hours after eating. So it's relieved by antacids and sitting up. That's why we tell people to raise their head of the bed 6 to 8 inches, and we tell them not to go to bed until 2 hours after they've eaten. It's diagnosed via an EGD, which is an upper endoscopy. And the big thing about that is you have to make sure that they have a gag reflex after the procedure before you give them anything to eat or drink. It's going to be treated also with PPIs. Remember, those are given once a day before breakfast. Antacids, H2 antagonists, and prokinetics. Okay, so remember those medications. So patients usually report indigestion, also known as dyspepsia, commonly known as heartburn. Okay, and they may have regurgitation. Now, patients can think that they're having a heart attack when they have the reflux, so they'll get like radiating pain to their neck, jaw, and back. They could have burning sensation in the esophagus, and they can have pain on swallowing, and pain that worsens with their position, like straining and lying down flat. So they can develop a sour taste in their mouth. They can also have tooth erosion because of the acid coming up. So those are the common symptoms of GERD. So patient teaching would involve telling the patient they need to be NPO 2 hours to 3 hours before they go to bed. They need to be on a low-fat diet, raise the head of the bed 6 to 8 inches so they can put the put blocks under their bedposts. Don't wear tight clothing, no smoking, E2OH, or caffeine, or anything that triggers their GERD. A hiatal hernia is a hernia where part of the upper stomach slips through the diaphragm and there's a hernia there. And there's all kinds of types, but basically it's the same signs and symptoms of GERD. If they need to have surgery, it's called a fundoplication. And they basically look at the picture, they wrap a piece of the fundus around the esophagus. So post-operatively, you would keep the head of the bed up. They would need a soft diet for a week, no carbonated drinks because that would make them burp, and they need ambulation and no heavy lifting after that type of surgery.